Good morning, and you are all welcome to Health Talk on Sun FM TV. Your trusted space where we unpack health issues with experts who care for your communities. I'm your host, Kenneth Safunda, and with me in the Mideast, I'm hosting Dr. Chirando Mlenga from Dola Teaching Hospital. He is joining us in the studio to come and explain about a disease called the epilepsy. So welcome to this great show, Dr. Chirando Mlenga.
Well, thank you so much for having me on the show.
Okay, you know, first thing, we start with the first thing at first. You know, the major topic for this morning, it's a disease called epilepsy. What is epilepsy? Especially on a common point of view, especially on a layman. Abantu bashishibe epilepsy chinshi.
Okay, so epilepsy is a neurological condition characterized by recurrent unprovoked seizures. So meaning someone will have VAMA fits, ILA without something obviously causing it. So things that may cause seizures are things like some people drink a lot of alcohol, then they stay away from alcohol. That would be something that would provoke a seizure. So that one, we may say that one has epilepsy. But if someone has seizures without any of these obvious things that might cause it, then you'd say, okay, this one has epilepsy. Someone is having seizures like that. Yes. Okay.
So now, Dr. Mlenga, how do you explain to the people, like in a local language, like in Bemba, how do we call epilepsy?
Okay, so Mchibemba, epilepsy will causing kusamfula repeatedly. Okay, now I'm going to but kusamfula more than mikushing without teaching to shiderenga.
Okay.
Okay.
So is there a specific or particular term that a person will be like ale samfla or kuntu muntalenda ale ensha or naikala mungande or something like that, or is there a particular term that a person would be attacked by epilepsy?
So epilepsy, seizures can attack you at any time. So kutuwasanga muntu ale ensha akota na accident or muntu ale enda hapo na pamso bamtola fya abantu bamtola kuchipatara. But most epilepsies, sometimes so it just depends.
Okay. So now, Dr. Mlenga, how do people know that this person has got epilepsy? How do you diagnose such people?
Okay, so epilepsy diagnosis would depend on, of course, if someone has had one or more seizures. More than one day, let's say they have a seizure, then perhaps days that's got an seizure, that's when you'd probably say not epilepsy clinically. So usually diagnosis is clinical, but there are other tests that we do also to help us make the diagnosis. So epilepsy, we'll do some blood tests first just confirm let's say if my electrolytes, if we know if you're calcium, then we also do like an EEG. EEG is a test where we put my electrodes per scalp to see how the brain is functioning, and then that will help us also tell what type of epilepsy someone has if we're able to pick out, because colors are different ways we classify, and that will also even help us determine what type of drugs we're going to give. Other things we'd also do are things like an MRI. So if we do an MRI and we find that there's an abnormality that will help us give us a diagnosis of the type of epilepsy, then that will also help. Sometimes the MRI may be normal if it's a genetic epilepsy. So we have some epilepsies. Okay.
But now the other question, Dr. Mlenga, now, like to the people, our viewers out there, how do they know that their relative or the person they are keeping has the epilepsy?
So how they will know is, like I said, epilepsy, because of the fact that there are different types. The commonest way is abantu baramboka tama checking arm movements by small limi by sunda wila then so bakwamba nimbe achipunda na kupunda na amboka samfula ma okuyamboka kuchitafide. That's a usual presentation of epilepsy. But kwa ma unusual forms, sometimes muntu imbe arife confused or amboka mone fintu fishili po. Those are some of the unusual presentations. Kai epilepsy is seizures just present depending on the part of the brain. Seizure.
Okay.
Okay.
So now, for instance, if in your household you have got somebody who has got epilepsy,
Yeah.
is there a likelihood that it would spread to another person within the house?
No, so that's one of the myths. People think epilepsy is transmissible, so it's not transmissible.
Okay.
Yes, even if you can live with someone with epilepsy. In fact, we encourage people to sleep in the epileptic patients not to sleep alone in the bedroom, because we worry that sometimes after our week muntu sakamina. So usually we advise that mu same bedroom no muntu ingamona ko ngawambo kusamfla back to because sometimes in epilepsy patients there's also the risk of them just dying in their sleep because by choking, and then they end up dying. Yes.
Okay, so you are advising us out there that whenever they have got a patient of epilepsy, they should make sure that he occupies the bed or the bedroom with another person.
Yes, so
especially an adult, isn't it? Not a child.
Yes, not a child. An adult who will help, because we also advise that, in fact, when someone is having a seizure, we advise that the person who's around moves.